Dr. Pollyea, when choosing a therapy, what questions should patients be asking their healthcare team about a treatment plan?
Yeah, so at the time of diagnosis, I think it's a reasonable question to say, is my disease amenable to a cure? Can I be potentially cured? And is this treatment part of a plan for a cure? If that is possible, then I would want to be walked through the steps to which, that's going to be executed. And if it's not possible for me to be cured, then I would like to discuss, what is the treatment plan that could potentially give me the longest duration of a remission and the best quality of life. And so, that's the conversation that I think is important to have. And then everything that we discussed comes into play there. An individual's sort of appropriateness for intensive chemotherapy versus less intensive regimens, and also the disease biology and what that may be make them a candidate for.
Yeah. Are there certain symptoms or side effects that patients should share with their care team?
Yes. So, I mean, we have a very, very sort of liberal request that, really anything should be shared. We have a 24/7 number to call with one of us on call at all times. So it's very difficult for a patient to kind of be able to appreciate, when they're going through such dramatic changes, hey, is this expected or not? So, we really emphasize oversharing concerns about symptoms. All these drugs have very different side effect profiles, and some of them are common and some of them are less common. The disease itself can cause symptoms and clinical issues. So instead of really trying to educate yourself in an impossible way on what could be or couldn't is not, related, it's better just to ask.
Yeah, get that answer. What is the role of a care partner when someone is in active treatment?
Having a care partner is crucial. This is physically and mentally extraordinarily stressful on the body and the mind. Having that support person for those purposes is really important. Having that person be an advocate for a patient, to ask those questions that may not be getting asked, to reframe questions to get the best answers, is really, really important. And then there's the more mundane things, just getting patients to their appointments and kind of keeping their morale up and those things. So, there's data and research on this that, patients with caregivers, they have better outcomes. When it comes to a transplant, a caregiver is not an option. You must have a caregiver. And the importance of that will be sort of relayed to you in the context of a discussion about a transplant. But a caregiver in the setting of a transplant is so important that it is a requirement to even be considered for that.